I think one of the major challenges in limited resource settings is not only determining what are the right things to do, but doing them right. Our science will tell us what intervention we ought to do. So should we provide treatment for malaria or prevention for malaria? Or our science will tell us whether we ought to distribute calcium to prevent preeclampsia, one of the causes of preterm birth. But it doesn't tell us how to make sure that every woman gets that intervention. I think developing nations are facing this very large challenge. How do you take this sound care, this sound intervention, so that every woman gets it? Because the health facilities in developing nations do not reach everybody. They barely reach 40 to 50% of people. So we have to change our paradigm. We have to figure out how we can take these kinds of care to women, not just expect women to be able to come to this care, which is so far away and so difficult to reach. And I think that is a challenge that many organizations are trying to face. And I think one of the things that I find very fascinating is that there are some countries that are making huge strides. And while we are all interested in learning about where the problems are, we ought to also look at those countries that are making real change happen, even though they have extremely limited resources. Let me give you a couple of examples. Tanzania is a great example of a country which has managed to reach near universal antenatal care. Now, the quality of that care may not be perfect. The interventions in that antenatal care package may not be exactly all of the things we want. But one of the things is women have decided that antenatal care is important for them and are struggling and making their way to our antenatal clinics. I think that's a huge, huge opportunity for us to take all of that pregnancy-related care, that 95% of period that we talked about, that really can make a big difference. Let me take another example. Nepal is a great country which, even though the proportion of births attended by skilled providers is less than 20%, they have made a dramatic decline in maternal mortality in the last many years. And they have done it through community approaches, through approaches that are different from our traditional medical approaches. And I think those are the kinds of innovative examples we need to look for so that we can do the right things and we can do them right in those countries.